Hi everyone and welcome back to another episode of GP Notebook TV. Today we're going to take a look at an article from the BMJ on a topic which is really important to general practice, that of the use of progestogens and the risk of intracranial meningioma. The article is called Use of Progestogens and the Risk of Intracranial Meningioma, National Case Control Study. The authors write that meningiomas account for 40% of primary tumours of the central nervous system. And while meningiomas are mostly slow-growing, histologically benign tumours, they can nevertheless compress adjacent brain tissue and thus patients can require surgical decompression. So these are a condition of definite significance. The incidence of meningiomas increases with age, rising sharply after the age of 65 years. Meningiomas are much less common under the age of 35, and there are other risk factors noted for meningioma, including being female, intracranial exposure to ionizing radiation, and neurofibromatosis. Recently, however, a new risk factor has emerged which I think has been of significant interest to general practice. I'm talking about the new evidence suggesting that prolonged use or more than 1 year use of high doses of 3 particularly potent progesterones such as cyproterone acetate, chlormidinone acetate or norgestrel acetate has resulted in an increased risk of meningioma. In the introduction, that is the evidence that existed at the time when they undertook their study, and they do look at what is the reason that we have this link between female sexual hormones and meningiomas, and they note that there is a biologically plausible reason for this. They note that progesterone receptors are present in more than 60% of meningiomas, and the volume of these tumours has been observed to increase during pregnancy and decrease postpartum. So when the authors undertook this study, as we talked about, there was existing literature that had shown an excess risk of meningioma observed with high doses of cyproterone acetate among cis women, men and trans women. The evidence for the other 2 progesterones we just mentioned was also present but a little bit less strong. But there are many progesterones prescribed very commonly in general practice, and the authors noted that the risks or safety of these other progesterones were less clear, and that's what they wanted to have a look at. So let's have a quick look at their study design. The study was carried out in France and used data derived from the French National Health Data System. This database is one of the largest in the world and includes information from health spending reimbursement for more than 99% of the population, and it's also linked to hospital discharge databases. The study design was a case control study, and this is a study which compares a group of people called cases. So these are participants possessing a condition of interest, in this case meningioma, and then a group of controls, so a similar group who are lacking the condition. In this study, the eligible cases were women residing in France of all ages who underwent surgery for intracranial meningioma between the 1st of January 2009 and the 31st of December 2018. Women from this group who had a pregnancy beginning 2 years before the index date were excluded because of the mechanism we've spoken about, where there is already that known relationship between pregnancy and meningioma. And they matched 5 women in the control group to each case, and so they were matched for year of birth and area of residence. The study looked at exposure to many different progesterones. Now, please excuse my pronunciation of some of these, as it is a long list of very similar sounding words, but they included in their study progesterones and different mechanisms of progesterone. So they had plain old progesterone, they had hydroxyprogesterone, they had dihydrogesterone, they had medrogestone, they had medroxyprogesterone acetate, they had promegestone, they had Dianogest, and then they also looked at the very commonly used intrauterine levonorgestrel, so they looked at those progesterone containing coils. They defined exposure as at least one dispensation within the year of the index date for most of the progesterones, and they made that within an exposure within 3 years for a levonorgestrel containing coil of 13.5 milligrams, or within 5 years for a levonorgestrel coil containing 52 milligrams of medication. They had a large number in the study, so in total just over 108,000 women were included in the study during the inclusion period of 2009 to 2018, and this consisted of just over 18,000 women in the case group and just over 90,000 women in the control group. The mean age of women was just over 57, and the most commonly represented age groups were women aged 45 to 54 with 26%, 55 to 64 also with 26%, and 65 to 74 with 21%. So now to the information that we're all really interested in. How do our commonly used progesterones, how did they fare in this study? And I have to say, I did feel some apprehension as I got to the results section, wondering how many of my commonly prescribed progesterones would perform. Happily, the results showed no increased risk of intracranial meningioma for our plain old progesterone, which is one I often prescribe as part of HRT regimes, our dihydrogesterone, or our levonorgestrel intrauterine systems, which again are another one for me that I would use quite commonly in daily practice. There wasn't sufficient data to report on some of the progesterones, such as Dianogest or hydroxyprogesterone, because of the small number of individuals who received these drugs over the trial period. They did see a highly increased risk of meningioma, again with cyproterone acetate, which was known prior to the study commencing, and they also saw this with no megestrol and chlormidinone acetate as in the previous literature. The new and very important information from this study relates to the excess risk of meningioma with the use of medrogestone, medroxyprogesterone acetate, and promegestone. This increased risk was driven by prolonged use, as we already mentioned, so prolonged use noted as exposure of greater than 1 year. The authors noted that the information that they got on these 3 progesterones in particular was quite important, and that there was a great need for more research in the area. But very importantly for us in daily practice, their work has actually led to warnings being sent to prescribers of this product. Our local guidance in Ireland from the HPRA acknowledges that there is an increased risk of developing meningioma with high doses of medroxyprogesterone acetate. So this means all injectables and greater than 100 milligram oral preparations. And this is primarily after prolonged use, and they note this as several years. It recommends that where products are used for contraception or non-oncological indications, medications containing high doses of medroxyprogesterone acetate are contraindicated in patients with a current meningioma or a history of meningioma. And if a meningioma is diagnosed in a person treated with high doses of medroxyprogesterone acetate, treatment must be stopped. That's our local guidance, but it is well worth looking at the local guidance in your own country. I know in the UK there has also been a signal noted on this. I have to say, just looking at this article overall, I found it to be fascinating and have a real impact on daily practice, as we've seen by its translation into guidelines. I hope you enjoyed this video, and I look forward to seeing you again on GP Notebook TV.